Hello, my name is Heinz Ludwig. I'm a hematologist oncologist working here in Vienna, Austria. And I just presented our study from our Austrian myeloma study group on the comparison of carfilzomib Revlimid dexamethasone with carfilzomib thalidomide dexamethasone given for 9 cycles to transplant ineligible patients. And after the induction therapy, patients were randomized to either carfilzomib maintenance, day 115 for 12 cycles, or observation. I just give you the results in brief. Actually, both regimens produced similar outcome data in terms of response rate, progression-free survival, and overall survival. When we did MRD testing after 9 cycles, there were slightly more MRD negative findings in patients treated with carfilzomib Revlimid dex as compared to KDD. We looked at different age groups. No difference in regard to PFS, but when it comes to OS, to overall survival, elderly people have shorter overall survival, which is natural. We also looked at cytogenetic high-risk groups. Of course, cytogenetic high risk makes a difference, and actually, the impairment in outcome is similar in both KDD and KRT treated groups, particularly in reference to progression-free survival. When you look at the overall survival, carfilzomib seems to overcome to some part the negative impact of high-risk disease. There was no difference, but the follow-up is more than 30 months, so maybe we have to wait for a longer time. And when it comes then to the maintenance phase, carfilzomib maintenance improved the progression-free survival, but only numerically. There was no statistical significant improvement. It was relatively well tolerated, but it is probably a treatment which you may consider in younger patient groups. Looking at side effects, adverse events, there were more grade 3, 4 adverse events with KRD regarding cardiac toxicity and rash. But when it comes to grade 1, 2, there were more adverse events, grade 1, 2, with carfilzomib thalidomide dex. There was more neuropathy, PMP, other neurologic side effects, edema, infections, thromboembolic complications. So there's a different pattern of side effects, and there are more grade 1 and 2 side effects on the carfilzomib thalidomide side. So in sum, both regimens exerted similar anti-myeloma activity, were active also in high-risk disease, but only in terms of overall survival, because there was a difference in progression-free survival. It is inferior in high-risk disease. It works well in elderly patients, but elderly patients have lower survival expectancy, and the toxicity profile is different in both groups.